and welcome to Menopause Monday. I am Kate, your host. I share weekly videos on a Monday to help you understand more about the menopause, help you overcome some of the issues that you specifically might be dealing with. Always send me a message. If you've got something you want me to cover in a future episode, I'm more than happy to do that. So make sure you message me what you'd like me to cover, and I'll make sure to add that to the list. If this is the first time you've come across me, please give me a like and subscribe to my channel so that you don't miss future episodes. In today's episode, I'm talking about menopause and urinary tract infections. They are something that women going through perimenopause and beyond through to postmenopause struggle with so much more often than beforehand. Largely that's down to the fact of our falling hormones, specifically estrogen. Estrogen has a double role. It helps the body manage bacterial levels more effectively, but it also as we go through the menopause, the lining of the vagina will thin and also become less elastic. So that also has a negative impact on how we're able to function specifically. I will go through what causes UTIs, how to prevent it, what to do if you've got one, etc., and the symptoms to look out for. But just know going through the menopause does increase your risk of getting recurrent UTIs. And I don't know, I mean, I've had them before in the past. Last time I got one, I was just out walking and I'd got some knickers on that we'd gone for a long walk, and there was a bit of, I don't know, a lacy bit that was rubbing against my leg. It was chafing just on the inside of my thigh, nowhere near my bits and pieces. And so I took them off. Well, then I got friction from I don't know, my leggings or whatever it was I was wearing on my legs that day. And because it was a long walk, by the time I got back, I was quite sore. Well, me and UTIs are an absolute nightmare. It goes straight up to my kidneys, and I was bedridden for about 2 weeks afterwards. I did try and flush it through first. I did all the stuff you're supposed to do, which I'll share with you in this video today as well. But some of us are more prone than others. And if you're one of those people who have had a UTI in the past, and it goes straight up to your kidneys, just get to your doctor fast. I ended up having 2 lots of antibiotics. I had the standard ones they gave me, and then they had to give me super strong ones because I was poorly. If somebody had set fire to my house, I'd have just lay there and rolled over. I felt abysmal. So just know that they can even lead to sepsis if you're not careful. So never disregard them. Don't let this be something to make you more afraid of them. But I think they are something that can travel up to the kidneys, and once they're there, you want to make sure that you get rid of that infection as soon as possible. So firstly, just to sort of give you a sort of an overview of what cystitis is. Cystitis essentially is an inflammation of the bladder. We have the urethra, which sort of goes from the outside up to our bladder, and then we have the ureters, which connect to the kidneys. So that's sort of the main anatomy. If you have most people, it's cystitis. It's an inflammation of the bladder. You might feel it because you've got like a heaviness in your abdomen. You might be getting the burning sensation when you go into the toilet, etc., etc. If it goes up to the kidneys, it's commonly known as a kidney infection. Pyelonephritis is what it's officially referred to if you have a kidney infection. So it's when bacteria enters the urinary tract and it just takes over. So we're talking about the negative bacteria, because if you follow me on social media, you know I'm always talking about healthy bacteria, and that actually does play a part in helping you to overcome it and to prevent it in the future. I will talk about that in a little while. But at this stage of the game, we're just talking about, it's normally E. coli, and that gets in. It can be caused by sex. It can be caused by friction. It can be caused by bacteria, because particularly in women are much more prone to it than men, because our urethra is so much closer to our anus, and our vagina is so much closer to our anus. Even if you are super clean and you're really careful, you can still, unfortunately, the bacteria can spread to your urethra and go up that way. So just be mindful. People always say wipe from front to back. I think that's common knowledge, but if you wipe from back to front, you are increasing your risk significantly of getting a UTI, because you're moving the bacteria to where you don't want it to be. So always wipe from front to back if that's of any help at all. to know if you've got a UTI, you're likely to be getting, like I said, you'll get that heavy feeling in your abdomen. You might not get that. I've not had that before when I had it before. I did have stinging on urination. I felt like I was bursting to go for a wee, and then nothing was there, or just a few drops, which is so frustrating. And it's horrible when things like start to go wrong. It can make your urine smell strong. I didn't have that, but I know a lot of people do have that. It can even happen in children. It's not just older people that it happens in. So, you know, if you've got a kiddie and they're not very well and their urine's smelling strong, just be mindful of the fact it could be a UTI. Unfortunately, some of us are more prone to it than others. So just be mindful of that fact. It's some people just think it's a sexually transmitted disease. It's not. It can be associated with STDs, but it's not in and of itself a sexually transmitted disease. So just be mindful of that. You might have cloudy urine. That often indicates you might have some problem there. It could even be pink tinged if you've got significant amount of blood in your urine. And in men can get it as well. They're likely to have more of a pussy discharge, but it's much more frequent in women, particularly, unfortunately, menopausal women. So how do you get it? I've already sort of covered that. You can also get it from I'm the worst at doing this, or I used to be. I'm not so bad these days. Again, I think this other occasion set it off. I've had it 2 or 3 times, and I was doing a course. I think it's my sports massage therapy course, and our lectures went on a long time, and I always drink a lot of water. And I remember sitting there, literally my bladder was about to burst, and I just kept thinking, oh, I'll wait till the end of the lecture. I'll wait till the end of the lecture. And I remember going home that evening and my bladder just felt sore because it had been holding so much urine throughout the day. And a day or 2 later, I got cystitis. So I think I'd actually exacerbated the situation by just allowing my bladder to get so full. It had irritated it and then become inflamed. I think that's what set it off. That's happened to me twice when I've had days when I've really held on to it, and both times I've ended up with cystitis. So just be mindful of that. If you're one of those people who holds on for it for ages, it's actually not very good for you. It can also be caused by prolapse. So again, that sort of midlife thing when we've had our babies, and you can have a prolapse, which is one of the pelvic organs pressing down onto the vagina. It can be a bladder prolapse. It can be the lining of the womb prolapsing down into the sort of the vaginal opening. It can be your bowel. So different prolapse types, and prolapses come in different grades as well, depending on how serious your prolapse is. But that can also lead to an increased risk of getting a urinary tract infection. So going back to sort of the menopause or the estrogen relationship, estrogen helps the bacterial levels in the lining and the urethra to stay healthy. Our entire body is made up of trillions of cells of bacteria, and there are good ones and there are bad ones. And it's about having the healthy levels, obviously, outweighing the negative or the harmful bacteria. So we've talked about sort of mechanical things like you can do to sort of make sure you wipe from front to back, not holding in wee for too long. Other things that you can do are obviously tight underwear too might exacerbate it, or no underwear, as it was in my case. A lot of ladies tend to use, was it Femme Fresh? I don't even know if they sell that stuff anymore. But I remember at one point, like the shops are full of these like scented products that you're supposed to use to wipe yourself with. Well, fragranced products, again, increase your sensitivity. They can help increase your risk to getting these UTIs. So if you're using anything, just use unfragrant soap, maybe just even water. You know, we don't need to be using harsh wipes and douches and powders and fragrances and all that jazz. We are natural healthy beings, and a natural healthy being doesn't need scented things to disguise other things. If you're disguising smells, go and get it checked. But just while I'm on that point, bacterial vaginosis is again something that tends to happen the more we get through the menopausal years. It can just happen. It can be caused by intercourse. It can be caused as again linked to an STD, but it doesn't have to be. Bacterial vaginosis, you'll notice it because you'll just smell different. You'll smell a bit pongy. You might have a heavier discharge as well. You might have a dull ache again in your lower abdomen. There is nothing to be ashamed of. Phone your doctors, explain your symptoms. They're likely to say it's bacterial vaginosis. They'll give you a course of antibiotics and you'll get rid of it as quickly as it came, pretty much. It's one of those that I think you are better to have antibiotics for, and then just make sure you have loads of healthy bacteria afterwards so that you sort of repopulate your gut, you know, with the healthy levels of bacteria, because antibiotics technically nuke everything. They get rid of all the healthy and the bad bacteria. Obviously, drink lots and lots of water. That's going to help you prevent it. When you've had sex, make sure you go for a wee, because if there's any bacteria there, any kind of urination is going to help flush it through. So that, I think that's common knowledge again, but I just thought I'd say it. Avoid spermicides. If you use a cap or a diaphragm or condoms with a spermicide, or have a spermicide already lubricating them, be mindful of those, because those can also increase your risks of getting UTIs. If you have a UTI, the best thing to do is drink loads of water, keep going to the toilet when you need to go to the toilet. Apple cider vinegar, if I had a UTI now, I would drink, well, I always drink apple cider vinegar anyway. There are some studies that suggest it might help, but there is no conclusive evidence. As with everything sort of holistic, there's very little conclusive evidence. Uva ursi, also known as the bearberry leaf. Uva ursi is a herbal remedy that is also, I've used that in the past and I think it works really, really well. Not on the occasions when it's gone straight up to my kidneys, but when I've had it otherwise. Uva ursi, you just put a few drops in your water. That helps you get rid of the UTI. But if you're if you're still getting the burning after 2 days, if you're starting to feel fluey or achy, get down to your doctor, just get some antibiotics. I actually think it's really good practice to keep hold of one of those little urine sample pots, because there is nothing worse that if you need to drop a sample off to your doctor and you've not got anything to put it in, you know, then you've got to go to the doctors and they might not be open. At least, you know, if you've got to go to work early, you can phone them, you can put it through the doctor's surgery door with a little note saying, please test this, and then they can phone you later and let them know what the sample reads, because then at least they know which bacteria are causing the problem. Get back from work, pick up your antibiotics or get somebody to collect them for you, and you can start your treatment straight away. So I'm not a great fan of antibiotics, but I think the UTIs and bacterial vaginosis, they are, personally, I think if you've still got symptoms after a couple of days, get antibiotics. Now, there's always, I think everybody says, oh yeah, cranberry juice. If you're going to use cranberry juice contains something called D-mannose, which is a sort of simple sugar, and that's found in oranges, apples, and cranberries. And what it does, it just helps to prevent bacteria from hanging onto the lining of the urethra. If you're going to use cranberry juice, go to your health food store and get the unsweetened cranberry juice. It is revolting. It actually tastes like liquid. It's like drinking liquid sandpaper. You can understand why it prevents anything from getting hold of it, because it's just, honestly, it's like drinking paint stripper, I should imagine. I call it liquid sandpaper. It'll be because it is so tart, but it can work. I think it can be quite effective. You don't want anything with the sugar in it, because the sugar is negative. You want to avoid everything sugary. You want to avoid spicy foods, caffeine, tea, anything with chili in it. I suppose that goes into the spicy foods category, and anything with sugar or artificial sweeteners as well. They are absolutely no go for UTIs. So make sure if you have got it, really the ideal thing to drink is just drink loads and loads of water, and probably still water as well, not carbonated water, because again, the carbonation process creates a small amount of acid in it. I don't know. I think if you can only drink sparkling water, that's better than nothing. But ideally, I would just say shed loads of still water and get it down your neck as fast as you can do. Now, strangely or interestingly, there was this study of ladies done. There were 75 ladies, and they were divided into 3 groups. So one group had never had a UTI in their life. The other group had had more than 3 in that year, but hadn't currently got an infection. And the other third had currently got an infection. And they tested all of their urine samples. The ladies who had never had a UTI had a much greater selection of healthy bacteria. I don't know if you caught my stories yesterday. I talk about the fact that we don't just need to eat probiotics, we need to eat a wide range of probiotics so that we can get the maximum from them. That's for our gut health, for our mental health, as well as our, our urethral health, our urinary tract health. So that was really, really interesting. And then another addition to that, so there were 30, out of those ladies, 34 of them took hormone replacement therapy. And those ladies had a greater number of lactobacillus, which is a healthy bacteria, in their urine. So it doesn't necessarily say that taking HRT is going to mean you're going to have more healthy bacteria, but it does suggest that there is possibly a link between hormone therapy and, obviously, because you're taking more estrogen, and estrogen helps us manage our bacteria levels, as well as keeping the lining, our mucous membranes stronger. Estrogen does help our mucous membranes stay stronger. You can use also like a topical gel. So if you don't want to take HRT, but say if you struggle with painful sex, say if you are having recurrent UTIs, you could chat to your healthcare provider about getting a topical gel or cream that is an estrogen gel or cream that you just literally use either inside the vagina or around the opening to the urethra. That also might have a positive effect for you. So there's a few various things there. I think in summary, if you're feeling ill and you've had it for more than 2 days, just get to the doctor, talk to your doctor as soon as possible. If you suspect you might have it, just shed loads of water, get good rest. A warm hot water bottle can help to soothe it. Obviously pain relief can, cranberry juice, but the proper stuff, not the sweetened variety, and uva ursi is also highly likely to have a beneficial impact on you. And lastly, just make sure for your health in general that you are eating a really wide range of prebiotics. Those feed the healthy bacteria, and probiotics. Prebiotics are things like chicory root, veggies, fruits and veggies. It's the fiber. Without getting too complicated, eat lots of fruits and vegetables. Those are the prebiotics. The probiotics are like the lactobacillus, the things that you'll get in kombucha, the fermented foods, kimchi, which I've tried, and it's just like, does anybody like kimchi? Ugh, maybe I should make my own. Kefir, that's another fermented milk product. I'm going to start making my own. I'm buying it at the moment, but I'm going to get my own brew on the go of that as well. As many different fermented foods as a tofu, sourdough bread is a fermented bread. As many different types of fermented and just healthy foods, probiotics that you can eat to make sure you are populating your entire being with as many healthy bacteria as you can. That is going to help to prevent you catching future UTIs. But remember, it happens to lots and lots of people. If you've got one, there's nothing wrong with it. Go and get help if you need it. And I hope this has been helpful. Sorry, my light is fading fast today. So if you've got any questions, drop them in the comments box below. Thank you for your time. If you're watching this on YouTube and you want to hop across to where I am on social media, you can find me at Kate Hartley UK on Instagram and Facebook. And I look forward to chatting to you next week. Thank you for your company.